How to care for a child with a fever. Once you have completed your assessment of the child, you will have gathered enough information about the child's signs and symptoms. Let's explore how to take the correct actions to treat and care for a child based on what you have found in your assessment. For more detail on how to do the assessment, refer to another video in this module. Remember that the illness can change over time and a child may get worse quickly. So, reassess the child in a follow-up visit and educate the family on the danger signs to look out for. Always keep your list of danger signs with you so that you can identify these quickly and refer the child to a health facility immediately. A fever can be a sign of a mild illness if the child has had the fever for less than 7 days and has no danger signs. It is then important to consider whether the child is at risk of malaria. This could be if the child lives in a malaria area or has been to a malaria area recently. If the child is not at risk of malaria, plan to follow up with the child in a few days or sooner if the child gets sicker. Educate the family on the danger signs to look out for and ensure they know that these mean the child needs to go to a health facility urgently. If the child has symptoms of a common cold, such as a blocked or runny nose, sore throat, or cough, explain to the caregiver how they can treat the child at home. All sick children should drink a lot of liquids, such as breast milk. If the child is older than a year, water or herbal or non-caffeinated tea with honey can also be given. Paracetamol, if it is available, can help to lower the fever and relieve the discomfort of a cough. If the child is at risk of malaria, do a rapid diagnostic test for malaria or MRDT if you can. If you cannot do a test, do not have any tests, or cannot prescribe medication, then refer the child immediately to a health facility. If the MRDT is negative, ask to follow up with the child in a few days or sooner if the child gets sicker. Educate the caregiver on the danger signs to look out for and what these mean. If the MRDT is positive, the World Health Organization, or WHO, recommends treating the child with an oral antimalarial. If you are able to prescribe medication, give the child the first dose and show the caregiver how to do this. Ask the caregiver to give the child the rest of the medication at home. For all children with a fever, advise the caregiver to give the child paracetamol if it is available. Explain why sleeping under a bed net is recommended for the family, especially the children under 5 years of age who are more at risk of malaria. Let's move on to when a fever is considered to be a sign of a moderate illness. This occurs when a child has a fever with an ongoing cough, or if the child has a fever, cough, and fast breathing. If the child has a fever and has been coughing for more than 14 days, ask the caregiver to take the child to a health facility as soon as they can, where they will be tested for tuberculosis or TB and get medicine to prevent TB. If the child has a fever, cough, and fast breathing, it may be due to bacterial pneumonia. According to the WHO, treating a child who has bacterial pneumonia with antibiotics such as amoxicillin can be very helpful. If you cannot prescribe this medicine, refer the child urgently to a health facility for treatment. Finally, let's look at when a fever indicates a severe illness. If the child has had a fever for more than 7 days, this is a danger sign and indicates a severe illness. If the child has a fever and any other danger sign, they are also very sick. For both of these, you need to refer the child urgently to a health facility. Do not delay by doing an MRDT. If you are able to prescribe medication and the child can drink, the WHO recommends giving the first dose of an oral antimalarial. Paracetamol, if available, should also be considered to lower the fever. This treatment can start working while they are on their way to the health facility. The following signs and symptoms also indicate a severe illness, and the child should be referred to a health facility urgently. Fever and a stiff neck or vomiting, or a headache, or struggling to breathe, or an axillary or underarm temperature of 35.5 degrees Celsius or less. For easy reference, we have made a job aid that summarizes the signs and symptoms and what to do next. Remember, if the child has any danger signs, they should be referred to a health facility urgently.